So if you would like to, please introduce yourself with your name, role and team in the chat, and your favourite style of hat and why. So you might wonder why hat. Well, today, just in case you didn't know, is a National Straw Hat Day. So I thought it would be good to introduce ourselves in terms of hat. We normally do food or drink, don't we? But yeah, what kind of style hat do you like and why? So I'm just going to open my chat up and see if we've got lots of people typing away. My favourite hat, if there's any sun out at all, is my what's called a Tilly hat, which is a kind of more outdoorsy hat. It's not one for style, but you can pack it up and put it anywhere, take it out, and it covers a lot of the face, which I need because I burn so easily. So that's my kind of hat. Fave hat is a sun hat. So Jill Owens, and you and I are in there together. Sun hatters, I love the sunshine. Fine. Well, I don't like the sunshine, Jane. So you and I are opposite there. I hide from it. Try and cover up from it. I've had too many bad sunburns to ever like the sun. So we'll move on to the next slide, please, Rupal. And we've got a baker style hat. I must admit, Wendy, I'm not sure what a baker style hat is, but I shall Google that afterwards. If we could move to the next slide, and we'll get started proper. So yes, welcome everyone, and it's great to see so many people joining us at this community of action on spread and scale of innovation and improvement. Our fantastic speakers. We have Jane, Julie and Arlene from the Product Implementation and Relationship Management team at NHS England, who are going to do their presentation. And then also delighted to say we have Rosie. There's Rosie, I can see her. Good. It's always good when we've got the speakers on, who's going to give us a little taster session on future NHS. So really welcome to you. Apologies from Suzanne and Paul, who will also be on the title slide when you see it, my co-convener and Rupal's colleague, who unfortunately last minute can't be with us today. But Rupal is our expert on the tech and is sorting things out as I speak, and I'm one of the co-conveners. So a very big welcome to you all. I'll proceed because we don't want to get behind time. In terms of update and actions, really delighted to say that the numbers of people subscribing to our Futures platform continues to steadily tick up, and we will be sending around again the link to that if you've not already joined us. It'd be great if you can. There's information on there about the community, notes of previous meetings and recordings, so it's really very useful. Oh, excellent. Lovely. Thank you, Rupal. We have the title slide. Maybe can we move on to the next one? I've got my fingers crossed. And the one after, fabulous. Thank you. And so that's the link there for the Futures platform, which we will be sending around with the notes to this meeting. And the WhatsApp group, a very informal group on WhatsApp. If you'd like to join that, either type your number in the chat, contact us, or you can scan the QR code and join. So it's lovely to see everyone joining us today. Thank you for coming. On to the next slide, please. What are the aims of today's meeting? Well, we're aiming to cover hearing from Jane, Julie and Arlene about the Change Management Network, going into breakout rooms to answer some of the key questions they have to allow us to offer our thoughts and ideas to inform what they do next, how they develop the network further. As I say, we'll hear from Rosie about the future NHS platform. And of course, it's a great opportunity for us just to connect and share our learning and our thinking, which is what this is all about. So very pleased to pass on to the next slide and hand over to Jane, who's going to get us started on creating and growing a vibrant change network across health and care. Jane, yourself, Julie and Arlene, you've got about up to a maximum of 20 minutes. I know it's a big ask to talk about a lot in that time, but that's just to ensure we've got some breakout room time. So over to you, Jane, and team. and when you want the next slide, just ask. Rupal, it looks like things are working lovely here. If they're not for you, then please pop something in the chat. Thank you, Jane.
Thank you, Diane, and thank you for the great introduction. And hello to everybody. My name is Jane Berezinski. I'm a regional head in the product implementation and relationship management team in NHS England, working as part of the Digital Enablement Directorate, which in turn is part of the Digital Directorate. Some of you may think, oh, so what's that got to do with community of action, spread and scale? We're doing quite a lot of spreading and scaling some of the digital solutions that are used by our frontline colleagues. And in fact, what I want to talk to you about is a change network that we set up about a year ago, which is good, but we'd really like your input and feedback as to how we can make it into, increase the depth, increase the breadth in particular of that change network, and how we can make sure that it is always a vibrant change network community for everyone across health and care. So if you could take me to the next slide, please. I think that just says I'm going to talk a little bit about the history, and I am going to talk a bit about the history. So where did we start? So we started just over a year ago, and there is a national forum which is called the CIO Touchbase, which is hosted by Sonia Patel. And at that stage, we were asking CIOs using a Menti survey about what subject matter expertise frontline colleagues needed more than anything else. And I think even we were quite surprised at the answer that we got, given that we were talking to a predominantly digital audience. And change management came up almost with the same sort of level of interest as cybersecurity. And there's loads of other changey words in that word cloud that was built out of Menti. So we felt like we had a mandate from the front line to establish this change network. So that's what we went on and did. Next slide, please. So in building this change network, we thought long and hard about who it was for. So we decided right from the get-go that it was for anybody who's interested in change, regardless of your job title, your role, your organisation. And it really doesn't matter whether you're somebody who's very adept and very accomplished at doing change management, or whether you're somebody at the other end of the change management spectrum. It really is for everyone, and we want it to be that learning community. Next slide, please. So we built this thing, and I'll come on to what the thing is, and we host it on a futures workspace. So therefore it's available to anybody working in health and care. It's freely available, it's accessible. We started in April last year. The last time I had a check on the membership stats, it was 926 at the end of April. And the futures workspace really hosts three distinct things. So we have a change management toolkit, which is composed of circa 72 tools that is intended to be a support mechanism, a range of tools, techniques to be used in change management throughout the duration of a programme or a project, from when it just starts off as that embryonic idea, all the way through to it's a product which is now in production, and we want to make sure that it continues to be utilised and adopted as well as we possibly can. There's also a discussion forum, and there's also, it's intended to have learning and support collateral as well. Arlene, my colleague, has very kindly put the link in the chat for you. So for those of you that haven't browsed that before, perhaps you'd like to go and have a look at what the Change Management Network is. So that's where it is. And next slide, please. Function that we work in, all of us, product implementation and relationship management. We're a central team, but we work out on the front line and we support a whole range of different initiatives. So at the moment, we're using our change management skills to work in secondary care. So some of you may have heard of frontline digitisation. That's the rolling out of electronic patient records to all secondary care organisations and there are different tiers of support that we provide. We're starting work with acute hospitals who don't have an ED, helping them with the change management associated with utilising electronic bed and capacity management. There is a major change to the way that cyber services are provided and delivered across health and care. So there is a data security centre in what was NHS Digital, is now NHS England. And our team is going to be providing, again, the change management for how cyber stance can be improved, risk improved across all health and care organisations. So that's a major transformational change programme. In primary care, similarly to frontline digitisation, there is an electronic patient record. Typically, that's been dominated by System 1 and EMIS, and there's a programme of work called GPIT Futures, New Market Entrants, which is looking at encouraging different service providers, different suppliers to come into the primary care marketplace. And again, we'll be supporting the change associated with using a new product. And the final area that we're supporting at the moment is the digital workforce. So we're providing some training, some facilitated learning for some of, but certainly not all, the informatics skills development networks across the country. So if you move on to the next slide. So that's kind of where we've been, what we've been working on, where our collateral is hosted. And I'm now going to talk to you about what we're seeing in terms of the consumption of those things. So if you move forward again for me, please. As I said earlier, we started last April, and this really is just plotting a trajectory of how many people have been joining our change management network on Future NHS. So it's moved quite well. But if you think of the size of the NHS and you think of the scale of change that the NHS is undergoing year on year, then you probably might reflect that that's a relatively small number in proportion to the number of staff that there are within the NHS. And if you move me on to the next slide again, the other thing we've been reflecting about is where our membership is sitting. So the data that we pull out of Future NHS tells us what particular region somebody works in, where we can identify it. And for me, this is quite interesting. So if you look at probably what is going to be one of the larger health and care economies, which is London, we've got fewer members in London than we have in the North West and Midlands. So we're wondering, why is this? And these are just questions that are going through our minds. Why have we got this regional variation, given that some of the work that we do spans health and care? And then when we start thinking again about why is it, if you click on again for me, please, we're going to have a little in-depth look at what's going on in the Southeast. So if you move to the next slide for me, please. So in the Southeast, if you click again, this is a screen build. So at the moment, these are the organisations that make up the change management network from the Southeast. And just a cursory glance down there, you can see there's quite a lot of secondary care organisations. There's a little smattering of CCGs, but not very many. And there's a little scattering of ICBs. So if you click build again for me, please. So we started looking at that, and it's really interesting that there's reasonable secondary care presence there. There's 30 trusts. There's nobody from pathology though. What's perhaps even more concerning is, given that we're providing this collateral for everyone in health and care, and we all know that it should be an integrated system, there's no presence really from local authorities, from the borough councils and district councils. So again, our question is, why is this? And what can we do to make a difference about that? looking at primary care, it's particularly light touch, and given that that's probably most of us as patients, that's our primary touch point with the NHS. Why is it that we haven't got as good representation in some of the other elements of primary care, such as dental practice or optometry? And if you could click for me again, please. So it's making us think quite long and hard about how can we make our services more accessible or more readily consumable across health and care. If you could click on again, please. So Arlene and Julie between them are going to talk to you about future developments before we pose our question that we would like help with. And Arlene and Julie, I'll let you introduce yourselves.
Thanks, Jane. If I could have the next slide, please. Hello there. So I'm Julie Wright. I'm one of the senior implementation and business change managers, and I'm working on the frontline digitisation programme. So I wanted to talk to you about our steering group that we have set up. And this is part of the membership on the NHS Futures site that Jane's been talking about. And we are in the process of making some recommendations and developments. We provide assurance to the Futures group in relation to our change management toolkit, and we respond to feedback in relation to that sort of product development and share that knowledge and experience around change management. And just as we were doing this, I saw that there's a number of people that have just joined the site, so that's fantastic. So I'm hoping that you will come along and possibly be a member of our representation, our steering group. It's nationally represented, and we're always wanting new members to continue to ensure that it remains a vibrant community. So next slide, please.
Good afternoon, everyone. I'm Arlene Morgan, Implementation and Business Change Manager, working with Julie and Jane. I'm just going to quickly go through the future developments that we're hoping to do. So the new version of the launch of the toolkit, which is on the Future site, we're hoping to launch that at the end of this month or early June. We've done a lot of work in the background, and we have some new tools added to it, and we've just done some general tidying up of some of the tools on there already. We want to increase participation from the network members. As Jane mentioned, we want it to be a vibrant and diverse community. So we're hoping that members will bring their ideas and capitalise on opportunities to connect with their peers with regards to change management. We're looking to address the disappointing survey results that we recently had. We put a survey on the site asking questions about ease of use of the toolkit, what people thought about its content, did they use it in their job roles, etc. Unfortunately, we had very low response rates, so we need to look at why this was, and how we can do a better survey in the future to gain that information, just to make some improvements. We also want to increase promotion of the toolkit. Every time we do facilitated learning sessions, or we do presentations such as this one, we always mention the toolkit, and we put the link in the chat, and we promote it as much as we can. But there may be other opportunities that we can utilise and make use of as well to do that promotion. So we'll be looking into that. We also want it to be more user-driven on the Futures site. So we can use a steering group, as Julie mentioned, as a meeting platform to help the promotion and gaining new members in that way. And then we want to look at the encouragement of case studies and shared learning submissions. Again, using the steering group or colleagues, how we can increase case studies on the system so that people can, take that away and bring them to their own organisations and help with their own change management projects. So that's future developments. If we can move on to the next slide, please.
Okay, so we're now having given you a little bit of history and a little bit of status quo and a glimpse into what we hope is going to be our future, there are a couple of questions that we would really like your input and your advice and your guidance about. So if you could just move me on to the next slide, please. Thank you, Rupal. So we're going to go into breakout groups, and we've got 2 questions that we'd really, really appreciate your reflections on. So that the 2 questions are, how can we promote and grow representation in the change network? And I guess I'm going to stress it across all of health and care. And then once we've done that, or maybe in parallel to doing that, how can we further develop the knowledge and the information sharing that we've got? You know, how can we get people saying, I've done one of these, would you like to see a copy of it? Or indeed, I've got a real problem with establishing a change network in my organisation. Could you help me with it? What are your hints and tips so that we can turn it into this question 1, truly diverse group of people supporting the change network, and 2, how do we turn it into a very vibrant learning community where there's lots of knowledge and information sharing? So those are the 2 questions, and I believe you'll see those when you go into your breakout groups. Is that right, Rupal?
That is, yeah. So I'll be posting a Google document that will have the questions there for you, and then you'll be able to input your responses into that Google Doc.
Thank you, that'd be brilliant.
Okay, lovely. I think if we move on to the next slide, I think that's your final slide then, Jane, and contact details there. So if we move on to the next one, while I say thank you to Jane, Julie and Arlene for that, that's fascinating. I think the challenge you talk about is one that many of us face, and I've been looking in the chat that others have been comparing what you've done, and there's praise for your website in the chat there, with some of the challenges and approaches that others have taken. So I'm sure there's going to be lots of opportunity for sharing of ideas and experiences. So as you said, these are the 2 questions that Jane and team would like your input on. As you go into the breakout room, if you take a note of the breakout room number, it could be at the top of your screen, and then go to the Google Doc and find the slide that corresponds to that number. So if you breakout room 3, look for slide 3 in Google Doc. The link to the Google Doc will be in the chat, both here and in the breakout room. And if you go in there, start your conversation, please type away into that Google Doc to capture that rich information. Don't worry too much about even spellings or, you know, full sentences. It's really about getting your ideas and your thoughts down, and that information be shared with Jane and team, as we've done with other teams in the past, and they really do find that depth of information really helpful. So those are the questions. Jane's explained it to you. We've got about 16 minutes in breakout rooms, which will be great. You'll go into them automatically and likewise be brought back, but you'll have some time warnings before you come back. And as you come back, we'd ask you to think of one key insight or thought or recommendation you'd like to share in the chat box as you come back. So out of everything you discussed, what for you as an individual personally would you like to say to Jane and team? Okay, so I hope that's clear. Rupal, you'll be whisking everyone off as if by magic into breakout rooms. Please do just introduce yourself and get straight on chatting around these questions. So how to promote and grow representation, how to make the membership and the activity even wider and even more diverse, and then how to help support further sharing that goes on within the network. So those are the key questions, and if the technology allows, here we go, off we go. Hello and welcome back, everyone. I hope you've had a great discussion. Many thanks for all the contributions in the Google Doc. We've just been having a quick look. That's tremendous. So I hope you found it useful as well. And thank you for sharing your ideas and suggestions. So as requested, could you now think of one key learning point from all the discussion you've had, one insight, one recommendation, your top one that you would like to share with the team? And as soon as you're ready, just pop it into the chat, and then everyone can see that. So this just provides some very quick feedback. As I say, the content of the Google Doc will go to Jane and team, and the document will stay open for the rest of the meeting. If there's anything else you think of that you want to add in, then please feel free to do so. I'm afraid my computer is also playing up, and the chat's frozen. I hope that Jane, are you seeing suggestions coming in to the chat? Yeah.
Yes.
Okay.
Yeah.
No, I've got it now. Yeah, lovely. Thank you, Carol, Wendy, Rosie, James. Thanks for your suggestions here. Two about being specific, target specific audiences, and Michelle and Rosie again. So some top tips there, some top suggestions, which I think would be really worth focusing in on. So thank you everyone for that. Delighted now to start to move on to the second presentation. We've just had a fantastic demonstration of how futures can be really beneficial, and our second presentation is from Rosie talking about futures in a more general sense. So I'm delighted to welcome Rosie to come and give us, as I said at the beginning, it's a taster about futures, because there's a lot to know and a lot to learn. And if people are interested to know more in this forum, in this community, then we could maybe try and persuade Rosie to come back and give us a more lengthy and more detailed presentation. I have to also mention that the Futures and team won last year the National Improvement Award for spreading change and improvement across the system. So really well placed to be here at this community. So over to you, Rosie. You've got about 7 minutes or so. Sorry for the time constraint, but 7-8 minutes. Thank you.
That's okay. Thanks, Dan, for having me, and Rupal for doing the slides for us. So yeah, I just wanted to give you a quick kind of introduction into Future NHS, otherwise colloquially known as Futures. Hopefully everyone here has heard of it, at least, if not already an avid user. But I'll just run you through a few things. If we could have the next slide, please, Rupal, to hopefully give you a greater understanding. So as the Future NHS team, our vision is that everyone in health and care has the power to easily and safely collaborate on their shared ambitions. That's what we work towards as a team. And next slide, Rupal. And our mission is to empower people to easily connect, share and learn across boundaries by providing one secure collaboration platform open to everyone in health and care, which is what we do. Supporting and encouraging networks and communities to set up and thrive through our expert support service. And you'll see an example of that today. It's been the perfect segue. We signpost our users to relevant communities, resources, knowledge and good practice, and by building skills and encouraging leaders in virtual collaboration. So hopefully today's already showing you examples of all of those. So I thought I would next just dispel a few myths about Future NHS, because it's been around a long time, and as we all know with the NHS, there's different rumours fly around about things all the time. So the first thing I wanted everyone to know, and spread the word please, is that Future NHS is for everyone in health and care. So it's funded by NHS England, but it is available for everyone in health and social care. So any organisation that's working with you, you can collaborate safely and securely on this platform. It doesn't cost anything to the end user either. I think that's maybe my next slide. So next slide, please, Rupal. There we go. Yeah, so there's no cost at all to the end user. There is an option, I think, if you want to have specific paid features on the page. There's a couple of our workspaces that have that, but most people use almost all the features for no cost at all. So that is a huge benefit of the Future NHS platform. So the next slide, please, Rupal. So the other thing that's really important is that it's really safe and secure. Your workspace that you set up, so workspace is what we call these communities on Future NHS. So anyone can set up a workspace as long as it's been approved by our team. The reason we approve it is just to make sure that there's no duplication. We don't want, 10 communities of change set up. We try and make sure there's one, and if someone wants to set up a new change workspace, then we ask them if they've already seen what's available. We direct them specifically to ones that exist. And then if that's still not going to serve the purpose that they want, then we will let them set up a workspace of their own. Perhaps they want a different kind of closed group. So we do try and interlink that to make sure there's as little duplication as possible across the platform. But yeah, you can share documents, you can collaborate on documents, you can share toolkits, videos, and you're in control as a workspace manager of how open or closed that is. So you might have a space that's open to anyone that's registered on Future NHS. Or you might, even within that space, have a private space that's only open to 5 of your members or a particular working group. So there's a lot of opportunity to really personalize the site to make it work for you and for your projects. So you can have open spaces within closed workspaces with an open page on them, so you can still share information that you're working on. And the other really great thing is that it gives you a full audit log. So you can see who's posted what, who's deleted what. We can go in and find all of that information that hopefully gives you the confidence to allow people to share without having to go through an approvals process. Because if something did come up, we have a regular, what's the word I'm looking for? We have a regular process to go through to make sure that there's nothing being shared on the site that shouldn't be, that things are at the right kind of level of security. As much as we can, we do regular compliance checks, but that full audit log should allow you the confidence to be able to share everything that's going on. So in the next slide, please, RuPaul. So I thought I would ask a few questions. I don't know if we'll have time to go through them today, but you're welcome to think about them and come back to me, or perhaps we'll do another in-depth session on Future NHS another time, maybe. But I wanted to ask you, how do you use Future NHS? And if you don't, why don't you? That's not a loaded question. There might be a really good reason why you don't. Maybe you haven't heard of it, or maybe you don't think it would be fit for purpose. Or hopefully I've just dispelled some myths that might help you and your team use it. And if you do use it, or you can see already from today's presentation how it's being used, how can we use Future NHS better to spread ideas at scale? So if anyone's got any questions or any thoughts on any of those, I don't know if we've got time to kind of open up the floor, Diane.
I think, Rosie, we've got a couple of minutes, so it might be easier if people pop things in the chat, particularly if they would like to hear more. I think question 3 is something that would be great for us to talk about as a community, perhaps. But yeah, and any immediate response, maybe if you prefix your chat comment with 1, 2, or 3, and then we know what it's corresponding to. I'd love to open it up, Rosie, but I think with a minute left, it's really tight, isn't it? But yeah, would definitely welcome the opportunity for us to look at this in more depth. As I say, we've heard from Jane and team about how it's used very, very successfully. I know as a team you wanted to make it even better, but huge numbers and activity already, which is fabulous. And we know from work that you've presented before that other teams have found Futures just so invaluable. So I think we're getting some messages in here, so that's good. Again, apologies, I'm struggling to see things, but yes, we've got some things coming in here, so that's that's really good. Rosie, you popped a couple of links there, which I'll include in the write-up as well, to a couple of blogs, particularly Alice's blog there, which really is a great place to start if you want to think specifically about how can Futures help spread and scale. So yeah, that's really good. Yeah, Rosie, you're finishing words.
Yeah, I just wanted to let you know that I've put those 2 links in the chat, both great blogs talking about how Future NHS can be used, and they might help you and your teams or someone that you work with think about, how Future NHS can help spread positive change across the NHS. Yeah, we've already got, I think, over 350,000 registered members and 3,500 workspaces. So yeah, it's a big community, and we'd love more people to join so that we can share ideas across health and care faster and easier.
Yeah, absolutely. Lovely. Thank you. So if you would like to hear more, if you think that's a good idea for us as a community, please pop it in the chat there nice and clear so that we know in planning for the next one. And I've already started trying to persuade Rosie to come back. So hopefully that's something that we might do. So thank you for that, Rosie. And Rupal, if we could go on to the next slide. We will finish before 2 o'clock because I'm sure many of you have got 2 o'clock commitments. So we have started in the last few months asking for feedback on this meeting. So if you can give us feedback either in the chat, or if you go on to Menti, those of you who are familiar with Menti, menti.com, and just pop in the code there, 52704245, or just scan the QR code. And at your own pace, please give a score for today's session between 1 and 10, 10 being the best. And then please share with us one thing that could have been better and one thing that you feel went really well. And we'll let that roll for a minute or two and then display some of the results. We'll keep that open till the end of the meeting, so please do add into it. We do look at all the feedback and discuss it and consider it and use that to inform what comes next in terms of the community, because this is our community and it's really important that we try and reflect what community members want and think. So lovely. It looks like people have been happy with today, so that's really good to hear. Thank you. Rupal, could we go on to the next one, which was what could have been better, one thing that could have been better? Okay, and we're getting some comments in the chat coming up too, so that's fine. Either way, whichever works better for you, either through Menti or through the chat, that would be really good. So one thing that could have been better, messaging and purpose. Okay, it'd be good to know if that's messaging and purpose about the community as a whole, or about the individual presentations, or about the meeting itself. So if whoever's put that, if you can maybe give us a bit more detail, thank you for that. Avoid lunchtime. Okay, if it's hard to pick a good time, but if you've got a time that you think would work better, please let us know. I'd be grateful for that feedback. A longer session, yes, time is always a pressing point. I think we'll ask the community next time, should we extend these meetings or not? Again, it's a balance. So thank you for that. Please keep the comments coming. And the final one, could we have Rupal, please tell us one thing that went well. I hope you can think of one thing. That would be really good. And just pop it in there just to hear what went well. That's not just to get praise, it's to ensure that what's going well we keep doing, and that we don't alter or change, that we hang on to what it is everyone likes. So with that, I'll maybe just leave it a little bit longer. Chat box info. Yeah, the chat box has been really good and lively. Thank you for your contributions. There's been some suggestions made, some connections made. If it's directed at the community, we go through all the chat and we will act and get back to you on things. And if it's connecting between you, then great, you know, run with it, and hopefully that's really helpful. So on to the next slide, please, Rupal. And just to flag up, we have 2 more meeting dates that should be in your diary. That's the next meeting, which is the 19th of June, and the one that follows that, which is the 17th of July. And as always, certainly at the moment, and I note the comment about the timing, avoid lunchtime, those are currently scheduled for 1 till 2 o'clock. So the next meeting is Monday, 19th of June, 1 till 2, with content details to follow. So that just leaves me with the great pleasure of, oh, here we go. There we go. If you want to see them, those are the dates, and just the final slide then, please, Rupal. So it just leaves the great task to say thank you to our speakers, Jane, Julie and Arlene. That was fabulous. Thank you also to Rosie for covering a lot in a short period of time, and importantly to the community members who have come along today, given your time and been so generous in the contributions, both in the Google Docs and in the chat. So with that, I'll just say thank you and hope to see you at the next meeting on the 19th of June. Thank you. Bye-bye.
Thank you.